Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare. Here's Jill Bowman.
Did you know that imaging technology can detect cancer the size of a BB? And did you know that imaging technology can show you the beautiful face of your unborn child as well as detect a heart attack? Cookeville Regional is proud to be the leader of imaging technology in the Upper Cumberland and wants to bring the best to you and your family. Join us this month as we learn about the imaging services both in the hospital and out.
For the patient's convenience, Cookeville Regional has opened an outpatient imaging center that offers a warm and inviting atmosphere with comfortable amenities located just 2 blocks from the hospital. Welcome to the Outpatient Imaging Center.
When we opened the Outpatient Imaging Center in December of 2007, our intent was to just make it a very comfortable setting. And so as you see, we've got a very comfortable seating. We have a fireplace in the lobby, a traditional diagnostic x-ray. We do phlebotomy services, perform CT, perform ultrasound. We have a true open architecture magnet for our MRI services. We also have a complete women's center services on the 2nd floor. We also house a nuclear medicine department on the 2nd floor. We want our patients to be very comfortable, all patients, so we try to open doors for patients. They're with a team member at all times to make sure they get to the proper place. We have a complimentary drink station. One of the other features of the Outpatient Imaging Center is convenience of parking up front. You get right out, can walk right through the front door and be helped out by one of our clerical staff to assist you with whatever exam you're having. Basically, we want it to just eliminate that clinical feeling that you may encounter when you go into a hospital.
Well, the Women's Center has been in existence since 1986, so we have really established a rapport with a lot of women that come back year after year to have their mammograms. One of the things that we've added is the mammo pad, and the mammo pad is just a little pad that goes on the mammogram machine to make it a little bit softer, a little bit more comfortable, and these are complimentary to all of our patients, and we have had a lot of good comments about them saying what a difference it made instead of having the cold plate. And to my knowledge, we're the only facility in the area that does offer the mammo pads to their patients.
Sometimes you get to make a difference in someone's life, making sure you do a good mammogram so if there is a cancer there, it's caught early.
I know when they told me I had cancer, it really scared me, but I came down and I was well treated. Everybody was so nice to me. I would come in of a morning at 8 o'clock and I would be back at work in Byrdstown at 9 o'clock of a morning, and I've been coming ever since. And they're so nice here. Everybody's treated me great.
Individual patient care and attention to detail regarding each patient are the things that are important. I think one of the worst experiences that women can have is getting that phone call that they had their mammogram and there's an abnormality on it. And having someone who they can work with and talk and hold their hand more or less through the process is really a fantastic thing.
We're very fortunate at the Women's Center to have a nurse navigator, and what she does is to follow patients through their journey if they have had a diagnosis of breast cancer, or she can help them through a biopsy. She is able to to help them at doctor's appointments, or if they have questions, help them there, and so she's been a great asset to our program.
I got good news. I don't have to come back for another year. Everything was fine. And I appreciate the way they treat me here. Well, my advice would be just to keep your regular checkups, and if they don't have a place to go, this is a wonderful place to come.
We hear over and over women that maybe have waited to have their mammograms done, and maybe the diagnosis of breast cancer comes up. But it is so important to every year have your mammogram, along with having your physician or healthcare provider do a breast exam, and also to do monthly breast self-exams. And if anyone has questions on how to do monthly breast self-exams, we do have models, and I would be glad to spend time and show them how to do it.
Digital mammography is currently state-of-the-art. I think that the ability to adjust contrast the way we're able to on digital mammogram, the edge enhancement, the computer-assisted detection program that we use that's like an additional set of eyes for us. I think that our technologists are really top-notch and provide us a level of service which really is quite tremendous. We spend a lot of time speaking with physicians about their patients. We're available 24/7.
Cookeville Regional also offers comprehensive imaging services at the hospital as well as several specialty imaging services. Michelle Zellner is the Director of Imaging Services.
Medical imaging can best be defined as tools that are used by physicians to evaluate disease processes in the body by either using sound waves, X-rays. In nuclear medicine, we use gamma rays. And all of these tools basically penetrate the body to create images. We want to offer the community everything they could need, and we do our best to do that. So we have state-of-the-art equipment here. We have a board and city council that has the foresight to allow us to have wonderful equipment. It's updated regularly. We challenge some of our staff to take a time out and make sure that they explain the exam to the patient. Oftentimes, we've done something 100 times in the past 4 days, but the next patient who walks in has never had it done before in their entire life. Something maybe we think is simple, like a chest x-ray. And we encourage the staff to take their time and speak to the patient about exactly what a chest x-ray is before the exam takes place. All this in an effort to make the patient comfortable with the procedure.
I think that it shows in the amount of time that we spend with them. Mammography in particular and the women's services really do require a little bit of hand-holding and a lot of sensitivity. And I think that we really do try very hard to provide that on a regular, ongoing basis.
There are times when heart disease may be diagnosed through a simple imaging scan. Cookeville Regional offers the latest in imaging technology to do just that.
About 5 to 10 years ago, cardiac CT became an imaging modality that was beneficial for patients. Up until that time, CAT scanners just weren't strong enough to image a moving organ, but with advancing technology, imaging a beating heart became a reality. Although the pictures aren't 100% compared to heart catheterization, they're pretty good. So sometimes people who come to the emergency room with chest pain, or even patients who are outpatient, we may choose to perform a heart CAT scan as an imaging modality from the beginning, as opposed to doing a stress test or proceeding directly to heart catheterization.
A patient with atypical chest pain that is at a low to intermediate risk for having coronary disease would be the most likely patient to benefit from this study. You wouldn't want to do an invasive study on them like cardiac catheterization when you think that the risk is low, but since the risk is never zero, you can't just let the patient go home. So we do this through the emergency room to see if they have disease or not have disease. This test has a very high negative predictive value, so if we say there is no disease there, there's no disease and it's safe to send the patient home.
The real benefit of heart CT comes in identifying coronary artery anomalies, or where the artery arises from an unusual location, or for determining how much calcium is in the artery, something called calcium scoring, which has some predictability as to a long-term chance of having a heart attack. In this patient, the front of the chest is here and the back here, the spine. Here's the aorta, the main blood vessel, and there's one of the heart arteries coming off the front of the heart. Here's the main chamber, the left ventricle, where the blood's pumped. And so by tracing this artery out, we can see that there's no blockages, which is very good for this patient. So the addition of cardiac MRI and cardiac CT to our program really brought us to the forefront of cardiac care, and this certainly in this area, in this region, and we always strive to stay at the forefront of cardiac technology.
To help in the diagnosis of vascular disease, Cookeville Regional offers angiography, an imaging procedure that allows doctors to examine arteries throughout the body.
Typically, we're looking for blockage or other pathologies such as aneurysm. Really anything outside normal anatomy is what we're trying to diagnose. It involves placing a needle in the artery, identify the disease process, and identify the correct therapeutic approach. I'd stress that here in Cookeville, we are really providing vascular surgery as you would see in any major city. I don't think there's anything we really lack here. I think our quality is outstanding.